If you find yourself rushing to the bathroom every hour during the day, waking up multiple times at night, sometimes not making it to the bathroom on time, you're not alone. This is overactive bladder and it affects millions of people. Today, we're going to talk about what is actually happening in your body, how to recognize it, and what you can do about it. Hi everyone, I'm Dr. Peter Aziz, your gynecologist and pelvic surgeon. In this video, I'm going to break down the science of overactive bladder in a way that makes sense. So overactive bladder, or OAB, is one of the most common pelvic health conditions I see in my practice. It can be disruptive, it can be embarrassing, it can significantly impact your quality of life. Here's the good news, it's treatable, and understanding what's happening is the first step towards getting better. So let's start with the basics. So overactive bladder is characterized by a lot of symptoms. Most importantly, urgency. That means a sudden, compelling need to urinate that is difficult to control. So it's not just one thing, it's a collection of symptoms that can happen together, or you can only have one. These symptoms can occur with or without incontinence. We call it urge incontinence, and that's usually leakage of urine that is happening with urgency. But remember, the key symptom here is the urgency. Not just feeling that you need to go, it's a feeling that you need to go right now, and you don't know if you're going to make it on time. So how does the bladder normally works? To understand what's going wrong in overactive bladder, we have to understand how the bladder normally works. So the bladder is a muscle, okay? Think about it as a balloon made of a muscle. The bladder muscle is called the detrusor muscle. So your kidneys produce the urine. The urine travels down and fills the bladder. So normally as the bladder fills, it remains relaxed. The muscles don't contract, simply stretches to accommodate more urine, and this allows you to store urine comfortably. At the same time, there is a sphincter, which is the little gate that opens and closes. It's closed to keep the urine from leaking out. Your brain and the bladder communicate all the time through the nervous system. There are some receptors, stretch receptors in the bladder wall. They send messages to the brain about how full the bladder is. When the bladder reaches a certain volume, you feel the first sensation that you need to urinate. But here's the important part. You can still control when you actually go. Your brain can send a signal back to keep the bladder relaxed. The brain is pretty much saying, no, not right now, you can wait. When you decide it's time to urinate, your brain sends another signal to relax the gate, okay? Open it and contract the muscle of the bladder, and this pretty much allows the urine to pass, and this is how we have voluntary control over the bladder. So what about overactive bladder? What happens? Something disrupts this normal process. The bladder muscle becomes overactive. The nerves, the muscles, they're overfiring. So instead of being relaxed during filling, it starts contracting on its own. This creates a sudden, intense urge to urinate, even when the bladder is full. I have a lot of patients, they tell me, I just went to pee. Why do I have to pee again 20 minutes after? Even it's just a little bit of urine, they constantly have that sensation they have to go. So if those contractions become too strong, they can open the little gate and cause incontinence or leakage of urine before you get to the bathroom. All right, so there is a lot of theories behind that. Mostly it's related to neurological issues that affect the nerve signals between the brain, the bladder. In other cases, maybe due to changes in the bladder muscle or increased sensitivity of the bladder lining. So what we do know is that normal communication between your brain and the bladder is disrupted. So we talked about urgency of urination. This is the hallmark symptom of overactive bladder. And again, it's a sudden strong urge to urinate that cannot be easily postponed. It's not the normal, I should find the bathroom soon. It's, I need the bathroom right now. There is also frequency of urination. You start urinating more than 8 times during the day and more than once at night. This is called frequency. I see patients that urinate literally up to 20 times a day. And again, we talked about waking up in the middle of the night, usually more than once. So 2 or more, this is considered nocturia or increased urination at night. Incontinence, we talked about, it's called urge incontinence because there are other kinds. And the urge incontinence, it's leakage with the urgency. So who gets overactive bladder? Pretty much everyone. It can occur to men, women, can occur at any age. Most of the time, it gets worse as we get older. However, it shouldn't be dismissed as something you just have to live with. Yes, there are some risk factors that increase your risk, like strokes, neurological conditions, Parkinson's, multiple sclerosis, spinal cord injuries. Diabetes can damage the nerves that control the bladder. Previous pelvic surgeries, pregnancy, childbirth, chronic urinary tract infections. There's a lot of things. If we can't find any cause, it's usually called idiopathic, or like we pretty much don't know the cause. So how do we diagnose it? Usually we start with a history. I want to know about your symptoms, when they started, how long have you had them, how often they occur, what makes them better, what makes them worse, how much they affect your quality of life. I'll ask about fluid intake, caffeine, alcohol consumptions, medical history, medications, because all of these things can have an effect on your bladder. We also do a physical exam. I usually perform a pelvic exam on my patients, check for prolapse, which basically means that the pelvic organs are dropping down, check the pelvic floor muscle tone, any signs of infection, any abnormalities. One of the most important thing that we use to diagnose is something called a bladder diary. I ask patients to record everything they drink and every time they urinate for about 3 days. This gives us an objective data about fluid intake, urgency, and any leakage. Because a lot of times we forget, especially when the condition gets really bad, we don't remember how many times we go to the bathroom, how much we drink. So keeping track of that on paper helps tremendously diagnosing and guiding treatment. We also do a urine analysis, urine culture, check for infection, check for blood in the urine, because urinary tract infection can also cause the same symptoms, so we have to rule that out. Sometimes we also check what we call a residual volume in the bladder, basically how much urine is still left in the bladder after you're done urinating. This is done very simply by just using a little ultrasound, or if the ultrasound is inaccurate, you might place a tiny straight catheter to drain what's left in the bladder. In some complicated cases, if we cannot make a diagnosis by these simple things that we discussed, we can do something called urodynamic testing. It's a test on the bladder and the urethra, see how much the bladder fills, how the bladder stores the urine, how the bladder empties, to see if there are any involuntary contractions or any leakage. That test isn't necessary for everyone, but it helps if the diagnosis is unclear, or if the initial treatments did not work, or when considering surgical intervention. So keep in mind, overactive bladder, it is not dangerous at all. It doesn't affect your health in any way. However, it's a chronic condition, but it's manageable. The symptoms can improve, and in many cases, we can reach up to 90% improvement of symptoms. We can't, unfortunately, get to 100%, but we have very, very successful treatments. It's not something you have to live with. You don't have to suffer in silence, thinking that it's just part of getting older. That is not true. There are multiple effective treatments available, ranging from lifestyle modifications, behavioral therapies, pelvic floor physical therapy, medications, procedures that we can do. And we will be discussing these treatments in another video. So if you're experiencing urgency, frequency, or incontinence, don't wait. Talk to your doctor. Seek out a specialist in female pelvic medicine so you can make an informed decision about your health. If you found this video helpful, please like and subscribe. Drop any questions you have in the comments below and I'll do my best to answer them. Remember, you don't have to live with this at all. Help is available and you deserve to feel comfortable and confident in your body. I'm Dr. Peter Aziz. Thanks for watching and I'll see you in the next video.